Hi everyone. In this video, we will be studying about the heart embryology, that is development of the heart and the blood supply of the heart. So first, studying about the embryology. What we need to remember is that here are five structures, okay, that will be giving rise to different structures in the mature heart. So first we have from above downwards, I am discussing. First we have truncus, then we have bulbous cordage, then we have ventricle, atria, and sinus venosus. So, how we will remember TB of the vas? Okay, truncus arteriosus, bulbus cordis, ventricle, atria, and sinus venosus. So, truncus arteriosus will give rise to pulmonary trunk and the aortic ascending aorta. Then bulbus cordis. See here the bulbus cordis and the ventricles. We know that in the mature heart the ventricles are below, but here the bulbus cordis and the ventricles are lying above in the embryological development, and then with the development these will come below. So bulbous cordis will become smooth part, and the ventricle, that is the primitive ventricle, will become the trabeculated part of the ventricles. Then atria will form the primitive atria or the primitive ventricle, they will form the trabeculated parts. So the primitive atria will form the trabeculated parts of the left and right atria. And sinus venosus, left will form coronary sinus and right horn will form smooth part of the right atrium. Smooth part of the right atrium. Smooth part of the left atrium is formed by the primitive pulmonary vein. Okay. So truncus will give rise to ascending aorta and pulmonary trunk. Bulbous cord is smooth parts of ventricles, primitive ventricle, trabeculated parts, primitive atria, trabeculated parts. Left horn, coronary sinus. Right horn, smooth part of right atrium. And on the left, we have primitive pulmonary vein. Pulmonary veins are that which bring oxygenated blood to the left atrium. So primitive pulmonary vein will form the smooth part of the left atrium. On the right, we have sinus venosus. On the left, we have the primitive pulmonary vein that is bringing oxygenated blood. And then we have endocardial cushions that will form atrial septum, membranous interventricular septum, and AV and semilunar valves. So, in between all the valves will form by endocardial cushion. Then right common cardinal, right anterior cardinal, they will form SVC. Posterior cardinal, sub and supracardinal will form IVC. These all we have discussed in the venous system. So that is all what we need to remember in case of heart embryology. So endocardial heart tubes are mesodermal in origin and they fuse to form primitive heart tube that will form endocardium. So endocardium is mesodermal, and then myocardium and epicardium will be formed surrounding that. Now let's see the coronary circulation. So in the coronary circulation, what we need to remember that RC or the right coronary artery, right is starting from anterior, but it will be ultimately going to the posterior, and left is starting from posterior and ultimately going to anterior direction. So right coronary artery, it is rising from anterior aortic sinus and courses right atrioventricular groove and then to the posterior interventricular groove, anastomoting with the left coronary artery. And left coronary artery starting from the posterior aortic sinus going to left atrioventricular groove gives anterior interventricular branch. Anterior interventricular branch that is known as left anterior descending and continues as circumflex artery. Then distribution. Right atrium, right ventricle. These will be supplied by right coronary. Left atrium, left ventricle supplied by left coronary. Except an area adjoining the anterior interventricular groove. Okay, area adjoining the anterior interventricular groove. Which artery is there? Left artery. So that will be supplied by the left artery. And if we see the posterior interventricular groove region of the left atrium and the left ventricle, then that will be supplied by the right coronary artery. Then we have the IV septum, okay, interventricular septum, that is supplied by the anterior 2/3 by the left coronary, posterior 1/3 by the right coronary. Then SA node and AV node. In the 65% of the people, this is supplied by the right coronary. Then bundle branches, right bundle branch and left bundle branch, and apex. These all are supplied by the left coronary. And 35% individuals SC node and AV node. So if we talk about right atrium, right ventricle, and the posterior interventricular septum and the SC node, AV node, these are the function of the right. And if we talk about anterior interventricular septum, apex, and bundle branches, and left atria and left ventricle, that are supplied by the left coronary artery. Then we see the branches. Right coronary artery will give the posterior descending branch that will be in the posterior interventricular septum. Left will give the anterior descending branch. Right will give the acute marginal artery. Left will give the obtuse marginal artery. And right will give the conus artery. Left also has a conus artery. So these three arteries are present in both the branches, in both the arteries. Okay, these branches, posterior descending or interior descending. Then is we have marginal artery, acute and obtuse marginal, and the conus arteries. And what extra the left one has got? Left diagonal and left circumflex. So left has got extra C and D, that is diagonal and circumflex. So here again I have mentioned right is going from interior to posterior. So if interventricular septum, that is important. If posterior comes, then it is right. And if interior comes, then it is by the left. Then we have triple vessel disease. What is triple vessel disease? That is both right coronary, left anterior descending, and left circumflex. Left anterior descending and left circumflex are the main branches of the left coronary. So if both the main branches of the left coronary and the right coronary are involved, that is known as triple vessel disease. Now here again it is mentioned that right dominant circulation. Right dominant circulation means posterior interventricular groove artery if that is arising from RCA. Okay, and in 65% cases it is from the right coronary only. Then coronary sinus. Coronary sinus runs in the left AV groove. Here in the embryology we have studied that the sinus venosus left horn was giving rise to that left coronary sinus. So left AV groove. Coronary sinus is related to left AV groove and drains into the right atrium. So here again this is mentioned. See here right coronary artery is starting from interior and going towards posterior, while the left is starting from posterior and coming anterior descending and interior circumflex. See here this one is from the right and this one is from the left. Then next we see few images. Here again we have the right, this is right atrium which is receiving SVC and IVC. This is left atrium. Then this we have the left ventricle, the bigger size left ventricle and the right ventricle. So this artery most probably will be from the RCA, okay, posterior interventricular artery. Then next we see the image. This is image of the papillary muscles. This is trabeculae. This is anterior papillary muscle, and this which are not prominently visible, that are posterior papillary muscles in the heart. Then next we have again, see this is the septum. So this is the membranous septum and here we have the muscular septum. And these are the papillary muscles, anterior papillary muscles, posterior papillary muscles. So that, and one image here of the arteries. See right coronary artery starting from interior going towards posterior. This is acute marginal artery. Then here this is left anterior descending, left circumflex and diagonal artery, and left marginal. Left marginal we know that it is obtuse. So right starts anteriorly and goes posteriorly and vice versa for the left. So that's all what we need to remember in relation to the coronary circulation and the embryology of the heart. I hope it will be useful for you. And if you like my content, please do subscribe my channel. Thank you.